Hey guys, Jim here. Welcome to our OBGYN Sonography Registry Review. We're going to go over some questions today. Feel free to pause the video after I ask the question, giving you enough time to answer it before I answer it. Let's get started. Question 1. This condition occurs in which of the following? A. Monozygotic twins with diamniotic placentation. B. Dizygotic twins with diamniotic placentation. C. Monozygotic twins with monochorionic placentation. Or D. Dizygotic twins with monochorionic placentation. The answer is C. Monozygotic twins with monochorionic placentation. This ultrasound represents TTTS, also known as polyoli sequence, or twin-to-twin transfusion syndrome. What happens is you get these abnormal vascular connections to the placenta. So like an artery to a vein that will shunt blood from the donor twin to the recipient twin. Question number 2. These types of twins represent what sign? A. Dual sign. B. Spalding sign. C. Hourglass sign. Or D. Delta sign. The answer is D, delta sign. In this ultrasound, you can see right here, the chorion forms a triangular shape, which will indicate a dichorionic pregnancy. Question 3. This ultrasound finding is more commonly found in A, cesarean section, B, home births, C, twin pregnancy, or D, ectopic pregnancy. The answer is cesarean section. In this ultrasound, you can see there's an ovarian thrombus, which is more commonly found in patients who have cesarean sections. Question number 4. Click on the artery responsible for feeding the occipital lobe of the brain. The answer is right here, the posterior cerebral artery. Question number 5. Based on these ultrasound findings, what syndrome is most likely present? A. Factorial association. B. Pentology of Cantrell. C. Holt-Oram syndrome. Or D. Treacher-Collins syndrome. The answer is B, Pentology of Cantrell. Two things in this ultrasound that are indicative of Pentology of Cantrell. The first being omphalocele. The second is ectopic cordis. Those are the two main sonographic findings that you look for in someone who has Pentology of Cantrell. Question number 6. If left undiagnosed, this condition will lead to an abortion in the second trimester. What is this called? A. Placenta increta. B. Placental abruption. C. Incomplete cervix. Or D. Placenta previa. The answer is C, incomplete cervix. Question number 7. Bleeding down through the cervical os is known as what? A, abnormal adherence. B, placental lakes. C, external abruption. Or D, concealed abruption. The answer is C, external abruption. Question number 8. Which of the following is true regarding the placental anatomy? A. The placenta is a discoid organ that weighs 100 to 200 grams and is usually 20 to 40 millimeters in AP dimension. B. The placenta is a discoid organ that weighs 300 to 400 grams and is usually 2 to 4 millimeters in AP dimension. C. The placenta is a discoid organ that weighs 500 to 600 grams and is usually 20 to 40 millimeters in AP dimension. Or D. The placenta is a discoid organ that weighs 500 to 600 grams and is usually 2 to 4 centimeters in PA dimension. The answer is C. The placenta is a discoid organ that weighs 500 to 600 grams and is usually 20 to 40 millimeters in AP dimension. In your study material, you probably read that the placenta is usually 2 to 4 centimeters in AP dimension, but be prepared to convert from centimeters to millimeters. Just move the decimal point 1 time to the right. Question number 9. This ultrasound represents what? A. Clinodactyly, B. Syndactyly, C. Polydactyly, or D. Radial ray abnormalities. The answer is B. Syndactyly. Question number 10. This ultrasound represents what? A. Radial ray abnormalities, B. Arthrogryposis, C. Polydactyly, or D. Clinodactyly. The answer is D. Clinodactyly. Question 11. Which of the following is demonstrated in this ultrasound? A. Clinodactyly, B. Osteogenesis imperfecta, C. Arthrogryposis, or D. Radial ray abnormalities. The answer is B. Osteogenesis imperfecta. This will kind of make the upper and lower extremities bow a little bit. So you can appreciate in this ultrasound, you can see the forearm is bowing here. And the femur is also bowing. Those are classic signs of OI, or osteogenesis imperfecta. Question 12. Osteogenesis imperfecta will result in easy bruising, occasional fractures, deafness, and what else? A. Blindness, B. Blue sclera, C. Hypertelorism, or D. Cleft lip. The answer is B. Blue sclera. Question 13. This type of lethal dysplasia is characterized by extra digits of the hand or the foot and an extremely small thorax. What is this called? A. Campomelic dysplasia, B. Thanatophoric dysplasia, C. Achondrogenesis, or D. Majewski syndrome. The answer is D. Majewski syndrome, aka short-rib polydactyly. Question 14. This ultrasound represents the most common type of lethal dysplasia. What else not shown in the ultrasound is also associated with this condition? A. Lack of vertebral ossification, B. Renal dysplasia, C. Cleabachidal, or D. Oligohydramnios? The answer is C. Cleabachidal. Cleabachidal will cause the skull of a baby to form abnormally in the shape of a clover leaf. Question number 15. Which of the following below describes this ultrasound in which both limbs are fused together and not fully developed? A. Syndactyly, B. Trisomy 18, C. Mermaid syndrome, or D. Rocker bottom foot? The answer is C. Mermaid syndrome. Question 16. Which of the following below describes this ultrasound when the embryonic disc divides after 13 days of gestation? A. Monochorionic monoamniotic, B. Dichorionic monoamniotic, C. Dichorionic diamniotic, or D. Monochorionic diamniotic? The answer is A. Monochorionic monoamniotic. So right here, we have a conjoined twins presentation in which there is one placenta, which is monochorionic, and one sac, or monoamniotic. This is the least common of all the twin scenarios. Question 17. Which vessel is being evaluated here? A. Umbilical vein, B. Uterine artery, C. Umbilical artery, or D. Ductus venosus? The answer is D. Ductus venosus. Question 18. What does this ductus venosus Doppler waveform represent? A. Normal ductus venosus Doppler waveform, B. Imminent fetal death, C. Possible IUGR, or D. Abnormal A wave reversal responding to early ventricular diastole? The answer is possible IUGR, or intrauterine growth restriction. Question 19. This type of gestation will occur if the morula divides during the first days of gestation. A. Dichorionic monoamniotic, B. Monochorionic monoamniotic, C. Dichorionic diamniotic, or D. Monochorionic diamniotic? The answer is C. Dichorionic diamniotic. This ultrasound represents the twin peak sign or the delta sign, which indicates a dichorionic pregnancy. Dichorionic diamniotic presentation includes 2 sacs, 1 or 2 placentas, and 2 yolk sacs. Question 20. Which of the following is true regarding the sonographic appearance of this ultrasound? A. This finding is caused by trisomy 18. B. Measurements are abnormal starting at greater than or equal to 6 centimeters. C, this is abnormal between weeks 10 and 14. Or D, the fetal neck must not be hyperflexed. The answer is D, the fetal neck must not be hyperflexed. This ultrasound represents increased nuchal thickening, which is common in trisomy 21 or Down syndrome. Measurements are abnormal starting at 6 millimeters, not 6 centimeters. A nuchal measurement of greater than or equal to 6 millimeters is considered abnormal starting at week 15 to week 21. Question 21. This animation will result in which of the following? A, monochorionic monoamniotic. B, dichorionic monoamniotic. C, monochorionic diamniotic. Or D, dichorionic diamniotic. The answer is D, dichorionic diamniotic. Dichorionic diamniotic means that there's 2 placentas and 2 sacs. So each embryo has their own placenta and they have their own sac. So they have their own space and their own source of nutrients. Monochorionic monoamniotic are twins that are sharing the same placenta and the same sac. Monochorionic means that there's one placenta in which both embryos are sharing. Mono being one, and chorion is actually Latin for placenta. Monoamniotic means that there's one sac that both embryos are sharing. Dichorionic monoamniotic means that there's 2 placentas and 1 sac. So each embryo has their own placenta, they're not sharing, but they only have 1 sac. Monochorionic diamniotic means that there's 1 placenta that both embryos are sharing, but have 2 separate sacs. Question 22. Which of the following cephalic indices is the correct measurements for this ultrasound? A, between 0.7 and 0.8. B, greater than 1. C, between 0.8 and 0.9. Or D, less than 0.70. So this ultrasound represents dolichocephaly, meaning that the skull is longer than expected, and your cephalic indice will measure less than 0.70. Question 23. This common ultrasound finding causes no symptoms, is usually undetected until adulthood, and is associated with what other finding? A, hydronephrosis. B, single umbilical artery. C, oligohydramnios. Or D, distended urinary bladder. The answer is B, single umbilical artery. This ultrasound represents renal agenesis, and a single umbilical artery is associated with this type of condition. Question 24. Which of the following represents this patient's ultrasound who has a history of early disruption of the membrane covering the embryo that resulted in fetal body constriction from trapped tissue? A, fetal alcohol syndrome. B, Treacher-Collins syndrome. C, amniotic band syndrome. Or D, Ellis-Van Creveld syndrome. Answer is C, amniotic band syndrome. Question 25. Which sonographic sign does this ultrasound demonstrate? A, dual sign. B, Spalding sign. C, Roberts sign. Or D, Delva sign. The answer is B, Spalding sign. Spalding sign is the overlapping of skull bones, which is usually found after a week of demise. Well, that concludes our first 25 questions of this first OBGYN sonography registry review. I'll hurry and write 25 more questions and upload that video as fast as I can. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.